And then I had a wonderful opportunity to meet the amazing Dr. Bueller at an ISHWISH, the International Society for the Study of Women's Health conference that a friend introduced me to. And it kind of navigated from there. I took her course. I became ASEX certified as a sex counselor, and she's been a wonderful, wonderful mentor and colleague to me. And over the years, our friendship has blossomed, and I came to her a year ago, 2 years ago now, and I said, we need a program for medical providers. Maybe medical providers don't want to go down the full road of ASEX certification. Some do, some don't, but we need to create something that makes sense where medical providers can start using their counseling skills that they're already using with their patients and how to navigate that. And that is how our ASHP program became, as we lovingly call it. The Accredited Sexual Health Provider course. It's a 30-hour course, and we're going to go over that tonight, what that looks like, and help navigate questions and answers and things of that nature. So I'm going to turn it over to my dear friend.
Yes, so thank you. Yeah, so when Dr. Quayle came to me and proposed this idea, I jumped on it. I'm Dr. Stephanie Bueller. I'm a psychologist, a certified sex therapist, and the thing that I think many people don't know about me is I've worked in a lot of medical settings, and that's really my passion, is to work at the intersection of medical issues, pelvic pain, and sexuality. So that's my special love, my specialization. I've worked in hospitals. I owned a wellness center with an endocrinologist. So, this idea of training medical providers, and I think we might have some mental health people on here as well who that's also their passion. But when Dr. Quayle came to me with this idea, I jumped on it. I've been in practice for a number of years. Currently, my practice is all about doing supervision and consultation, and then doing continuing education, and I do writing as well, and I'm the author of a book called What Every Mental Health Professional Needs to Know About Sex, and it was published by Springer. We didn't know how to put in there for medical providers too, but it's certainly accessible for any medical provider. So that is what we are doing here. And I think we've had a few people, if you haven't yet put your location and your profession in the chat, you can go ahead and do that, and we'll take a look at that in a moment. I see Sheena is from Annapolis, Maryland, and so anybody else wants to put their name and location in the chat, we'll look at that later. Let's see, so we can share, I think what our idea was to actually share the syllabus and talk a little bit about, everybody can see this now. Yes.
Yeah, can you all see that? Hopefully, I can see it on my end, so I'm thinking that's a yes. We can see it.
Yeah, so I have
perfect. Thank you.
Okay, let me get bigger. No, that's too big. Okay, so the program is hybrid program. It's we have 13 hours virtual conference, and that takes place on April 22nd and 23rd, 2023. We go from 9:30 Eastern time to 5:30 Eastern time. And it is a jam-packed, jam-packed with incredible speakers. Like really,
we're a little nicer this year. We actually are giving you a little more breaks and a little bit of a lunch.
Yes,
Last time we didn't, because it was so much.
Yeah, we have so much. And then Dr. Quayle and I recorded 17 hours of really juicy content for you. So that's basically what this program is. It's 30 hours. We do have approval from a Medco to offer CME. If you are a mental health provider, I know as a psychologist, I can use CME to renew my license. But if that's not the case for you, we are happy to give you credit from American Psychological Association. So we're covering all kinds of, we're so much trauma-informed care, men's sexual health, women's sexual health, care of the LGBTQ population. We actually have two speakers, sex and the patient with cancer, pharmacology, religion, sex and pain. Like we have
with a
so
physical
much that we're
therapist.
covering. I'm just going to slowly I'm going to tantalize you by slowly going through the objectives. I have these amazing things that we're going to be teaching and we're going to be covering over the course of the weekend. And then we have these incredible speakers, and many of them Dr. Quayle obtained for us, but yeah, we have some truly like stars in the field speakers. So maybe you want to talk a little bit about like Dr. Rachel
Yep.
Rubin.
Yep. So Dr. Bueller and I will open it for you. And we have my amazing dear friend, my colleague, a mentor to me, the amazing Rachel Rubin. You probably, and if you don't, you need to follow her on Instagram at Rachel Rubin. She gives such wonderful tidbits of information on all things men's health, women's health. She's a huge advocate of all things in the sex arena. So her passion is genitourinary syndrome of menopause and what that looks like and how to navigate it with our patients and how to counsel and talk to them. So she's going to open it up for us because she's such a dynamic speaker that I said, you know what, you can take the stage, Rachel, and take over. And then from there, Dr. Bueller and I are really going to go into how to implement this. One of the biggest things that a lot of people have asked for and that I spent quite a bit of time on was kind of how to bill and code. I'm going to talk to you about different things around insurance models versus membership models versus fee for service and which codes you want to use. It's a great, great program. You're going to get access to all the PowerPoints. Whatever we do in the live sessions, you will have all those PowerPoints. And then you will also have you'll also have recordings. We're not recording the live, but you'll have all the PowerPoints. Dr. Bueller, I'll let you talk about Ellen and Natasha, and then I'll jump in on the other ones.
Right. So we have Ellen Barnard, who is a certified sexuality educator, and she will be speaking about sexual aids, lube, and toys. She is so knowledgeable. She had a business in I think in Madison, called A Woman's Touch, and lots of information on her website. She's passed the baton of the business to somebody else, but she ran that business for a very long time. Her passion is doing just this, is speaking to medical providers about how to talk to patients about using lube, using toys, and she has a really great presentation. And then the other person I want to talk about is Natasha Helfer. Natasha is a marriage and family therapist, and she's a certified sex therapist and supervisor. She is going to speak about sexuality and religion, and a major expert in the field. She has podcasts and does writing. She just wrote a chapter for a book. Really knows her stuff. And also she like me, one of the reasons that Natasha and I gelled so well together is that we both have a background in medical family therapy. So she is familiar with working with people with medical problems as well.
We're also going to have Dr. Maria Uloko. For those of you who don't know her, she was trained just like Rachel and I from the amazing Dr. Irwin Goldstein, who I like to call the GOAT of sexual medicine from a medical standpoint. She was also his fellow. She now works with him as well as the head of DEI at UC San Diego. She is also, if you are Instagram people, the one that just won the best paper for taking away the idea that there are only 7,500 nerve endings in the clitoris because it was looked at on cows and finally looked at it on the human model. And believe it or not, women have over 10,000 nerve endings in the clitoris. So that's her paper. So I feel super honored that she's going to come and talk to us around all things kind of DEI and LGBTQ, and you can see that's only an hour, but she's going to get in as jam-packed much as we can get in there, and we have a little bit more on that and some more in the asynchronous, but she is amazing. And then another dear colleague and friend is Dr. Maureen Ryan. She is a nurse practitioner and a sex counselor, and does a lot of couples counseling. And so a lot of times people that go into this arena of wanting to learn how to counsel their patients, when we're looking at this as medical providers, we often see maybe just the patient, but what I like that Maureen brings to us is how to bring the partner in the equation, which is going to look a little different for us being medical providers. So we really kind of try to navigate that as well.
Okay, so that is Saturday. And then on Sunday, we get Dr. Pebble Kranz, who is very dear. She's very dear to both of us, but I really have become very friendly with her. She has such a wonderful manner about her. And even though she works with both men and women in her practice and transgender people in her practice, she is going to be speaking with us about male sexual health. And she gives us a few case studies that we can learn from as well. And she also, being from Rochester, has that really integrated perspective. And actually her husband works with her in her practice, and he's a psychotherapist. So
Dr. Tara Thompson's my dear friend and my co-host for my podcast, Just Ask. And I am just so honored to have her in my life, because everyone needs an amazing pharmacist in their arsenal. And so she does all things around pharmacology and sexuality. She is the sexual health pharmacist actually on Instagram, and puts a lot of useful information on how to navigate what compounding looks like. She just gives a lot of wealth of information. And I feel like that pharmacology piece, especially for us medical people, around sexuality is missing, and how to navigate that for our patients. So she's going to give quite an extensive talk around that. And then she has just a numerous amount of PowerPoints that she gave to all of our participants last time. So it's just a great lecture. Michelle, I'll keep going. Sorry. Michelle Sariev is a nurse practitioner. She does a lot around gender affirming care. So she's going to talk to us about what that looks like from a perspective of prescribing as well as counseling, and kind of wearing those hats. So very wonderful information on there and around hormone replacement. And then for my Georgia people that live in this area, especially the Roswell ones on here, Dr. Jessica Reale is a doctor of physical therapy. She owns her own practice, Southern Pelvic Health, actually in East Cobb. And she is going to talk us through pelvic floor physical therapy, what that looks like from a perspective of counseling, and how do you explain to your patient. A lot of times I found that when people are working maybe in primary care or even GYN, and they recommend physical therapy, there's a lot of unbunking that needs to go around physical therapy, because patients are expecting, oh my gosh, they're going to go in and do what for me? Just like the sex therapists are out there, and you mention it to a patient and they think, oh my gosh, I have to go have sex in front of somebody. So a lot of it is really how to talk to your patients and how to counsel them and how to have that sex education with them on what they're experiencing, and what's gonna happen when they go to the pelvic floor PT. And she's great. She kind of talks to you through different musculature and things of that nature as well. So wonderful addition.
So before we talk about the videos, I'll stop sharing. We'll talk about what other things you'll be learning, but just to take a pause and see if anybody has any questions at this time. So far, so good. Okay.
I'm going to move.
Hi, I have a question.
Yes, please.
Is this course or this program the most appropriate one for someone without a medical background, like I'm an LPC, or for like a social worker or something like that?
I think it is, well, I will say this. If I had been when I was working, say with the endocrinologist, and that was like 20 years ago, and I had to learn sex therapy and I had to understand, I had a background working with people with cancer. So if I'd had this course back then, I would have been ecstatic. So I'm very excited to have created something that I think mental health providers who work in a medical setting would really enjoy and really get a lot out of.
I agree. I think it's such a biopsychosocial approach. And I feel like sometimes we stay siloed in our profession. So we're either siloed medical, siloed in sex therapy, counseling, or siloed as a PT. And so I feel like this brings the best of all biopsychosocial and why we really need to be very team centric. So I think it's a great course for mental health, medical, and physical therapy.
I see we have a question. Is the CME approval only for mental health professionals? Actually, it's the other way. CME is continuing medical education, and that is primarily physicians, but other medical providers look for CME. And then we also have, I'll put in the chat, we are also APA, the Bueller Institute is APA and NBCC approved, and we are also ASECT approved. And if anybody's interested in learning about insect, it sounded like I said insect. I went, no, I didn't say insect. Asect. I'll talk about that at the end or towards the end. But those are the approvals that we have. Anything else? Yes.
Hi, can you hear me?
Yes.
Okay. So I'm a nurse in primary care. I'm wanting to know, would this course be a good intro or teach the foundations that's needed in order to teach sex education, not only for the staff, but I'm wanting to do it for my patients. I have a lot of the elderly and especially men who are dealing with ED and because of other medical issues, Viagra is not working anymore. So just wanting to give them, to be able to educate on that and also to help women who are after over 40, but wondering would this course be good for that? Because it sounds like it's more towards the medical. I'm not prescribing and I won't be doing the therapy, but more the education, wanting to teach some tips and tricks and things like that.
I think it will be. I think it'll be really helpful. I mean, we're going to go over some modalities, of course, around medical diagnosis and treatment management, but it doesn't mean that you as a nurse can't tell your patient almost in like a coaching respect to say, you should talk to the primary care doctor about maybe prescribing you testosterone. It may be a good idea to have the primary care run your hormone levels and to educate them around how to navigate and how to be the best champion for themselves. We also have videos on anatomy. We have a video on sexuality and older population, which we can get into. So I think it could be a very, very good course for navigating that piece.
And actually, I think if I go into the videos and you'll see a little bit more about what else we have included. So right at the end of the day, we'll Dr. Quayle and I will do case studies. So these are all the videos that we have, right? Like it's we have an hour and a half of sexuality counseling. So, Helen, if you're interested, like, how do you talk to people about sex? That, we're going to do a lot of that over the 2 days, but this one video is specifically on that. How to use the implicit model, how to figure out who is a short-term, I can give you some information and send you on your way, or, oh my goodness, I think that we need to, refer you to somebody then who can go a little deeper and work with you a little longer. Solution-focused approach to sexuality counseling. you know, I think this is a brief model of counseling that is very easy to learn, but also very effective. Sensate focus, how to do a touching activity for couples, but also individuals can do it with themselves. Then we have trauma-informed care, and Dr. Quayle is an expert in this area. Culturally sensitive medicine, anatomy overview, counseling, 3 hours of counseling for male sexual dysfunction, sexuality counseling for female sexual dysfunction, sexuality counseling for pelvic pain, for cancer survivors, for infertility, working with the older adult, working with parents of LGBTQ minors, conducting a sexuality counseling intake, and pregnancy and postpartum sexual health. So you can see that we have just an incredible amount of information that we are sharing with you over the course of 30 hours. It's a very concentrated program, and I think just gives you an amazing foundation. To me, the advantage of taking this course is that, you know, I can tell you from my experience of learning sex therapy, and it was the endocrinologist who said, you need to learn sex therapy because I'm testing people's hormones all day long. And you know what? It's hardly ever their hormones. And I want to refer to you. I'm like, yes, okay, I will go learn that. And I went to, I don't know how many conferences trying to piece together what I needed to know. It was very difficult. So if this program had been in place, I mean, I created an ASEC program, but if this program had been in place, I would have been so happy because I would have understood from beginning to end what to do with my patients or my clients. So.
The other thing we've given you that we didn't mention is we also gave you a toolbox. And what's in that toolbox is a lot of useful information. There's articles that we've shared, articles I've written, articles Dr. Bueller has written. I've given you instructions out of my practice on how to use dilator therapy, vulvar vaginal health, vulvar care, moisturizers, all those things. And you can use those resources to educate and to share with your patients as well. So it's kind of an added bonus, all of the stuff that we have put in there. We've given you lists of resources for your patients. I wish, as I was going through ASEC certification, that I had more in my arsenal around what other resources were out there for them. So if I wasn't comfortable navigating certain things, where could I send them? Where were other places for other providers doing this? We do have some more questions. What about being an educator and leading community classes? I think this gives you a really good base. And I think it's not going to be everything that you want as an educator, but I think a combination with a course like this and maybe purchasing some more books and things through some of the resources and websites we've recommended, I think it'll get you a very solid program starting. Hold on, I'll come back to you on that longer one. Would mental health providers be able to get accreditation for certification? I'll let you answer that.
Yes, we are ASEC approved as an institutional provider, and that means that everything, so this program is being run through the Bueller Institute. Our website is learnsextherapy.com, and the Bueller Institute is approved by the ASEC, as well as the American Psychological Association. What we had a few people from our last cohort that wanted to pursue ASEC certification. So we put together a program that fills in the gaps. It's quite a lot. So I'll talk about that a bit later because there's a lot to ASEC certification. But we figured out, okay, what's duplicate? What do you need for ASEC? Okay, this is the package. This is how you go on if you want to get ASEC certification. And we apply I think we applied the whole cost of or almost the whole cost of the program, this program, the ASHP program, to the certification program, which
Yeah.
is really cool.
To answer that question, are you a good fit if you're not licensed in the field or medical or mental? That's a tough one. I don't want to sell you from not doing our course, but I really feel that this course is more for someone who's working in medical, mental, or PT that has seen patients or clients on a regular basis and is looking to bring more to their program. I don't know that I would recommend this as a first-time course. I think you need more experience under that.
I would agree. Yeah, it's kind of interesting. We often get at the Bueller Institute, we get questions from people saying, how do I become a sex therapist? How do I become a sexuality counselor? And it really is about having a background as a licensed mental health professional or a licensed medical provider. I know that in some parts of the world, there's no such thing as getting a license, for example, as a psychologist, and you would work under somebody else's license. So I'm aware of that. But here in the States, you need to have a license to practice sex therapy. Any other questions about our program? Okay, so if I could, if you can put into the chat, how many of you want to hear information about ASEC certification, that would be great. Second. You do, interested. Yeah, we'll get into cost in a moment. Yes, okay, cool. Okay, so that's quite a few. Okay. Okay, so I'm going to take oh, that's a lot. Okay, so let me, I'm going to share my screen and I'm just going to go through kind of a quick PowerPoint because I could spend like an hour. And, you know, ASEC is kind of complicated, but I do have a quick PowerPoint on how to get certified as a sexuality counselor. If you are a therapist, it is very similar to this. But since our ASH program is primarily for medical providers, I thought I would go through what's required of a counselor. So to become a certified sexuality counselor, you have to have a license as a healthcare professional. You can also be, there are people who are like pastors, for example, who do a lot of counseling in their professional capacity. So we do have some people that are not licensed as medical providers or mental health counselors. I guess you could ask. You can send an email to us specifically, info@learnsextherapy.com, if you have any other questions about that. It's 150 hours of education and sexuality counseling. And it's very broad, whereas the ASH program is very focused. The hours of education and sexuality counseling are very broad. It covers, I don't know, you know, you can imagine with 150 hours, all the things that are covered. You will have to provide 100 hours of clinical sexuality counseling while you are under the supervision of an ASEC certified, and actually that's wrong. It should be an ASEC certified counselor supervisor, or it can be an ASEC certified therapist supervisor. Let's see, 25 hours of supervision of your hours, and you have to attend an experiential workshop called a SAR. So those are the requirements. You have to have
Can you explain what a SAR is? Because I bet a bunch of my medical people have no clue.
Yes, I will.
Perfect.
I may have a slide on it, but I'll talk about it now, because a SAR stands for Sexual Attitude Reassessment. It is a unique experiential workshop it can seem kind of mysterious. The reason is that everything that is said by the participants in the workshop is kept confidential. So, for that reason, there, people don't talk about that much. Our SAR is, how can I say? So many of the SARs do show sexually explicit material. The idea is some of that is to desensitize you to the kinds of problems that people will come in and talk about, but it's also for you, a time for you to reflect and check in on what you're comfortable with and what you're not comfortable with, and what things you might need to get more comfortable with, and what things you're going to be like, you know what, not my thing. So, and that's that. Nobody's going to try to change you in a SAR, but it's understanding your own values and biases around sexual issues and sexual matters. And we have a SAR at the Bueller Institute coming up a lot. We're going to do it live. We've been doing it online. So we're so excited. We're going to be doing it live in April. I think the week after this workshop, and we'll do another one online in the fall, but ours is really focused more on like on people. I show quite a few documentaries and things of that nature, and people talking about their sexuality. So that
Can
is
I
what SAR is.
Can I caveat on there? I think that going to a SAR also, even if you don't go through ASEC certification, I think it's a really helpful place, like Dr. Bueller said, so that you can navigate like where your hard stops are. There are certain things that I know are not in my comfort zone, and I kind of really figured that out with doing the SAR. And that's why, again, having a toolbox of all different resources that are out there for you, so that you know how to tell your patients, that's not my area of expertise, but it's this person's. And I think that's where the SAR really helped me hone in. So I think it's great to do, even with this program, even if you don't pursue ASEC certification.
Right. I think that is very true. You don't have to be pursuing ASEC certification in order to attend a SAR. Let's see what else. Certified counselors, MDs, NPs, RNs, PAs, PTs, OTs. Sometimes we get pastors and other professionals. The 150 hours of education, 90, this gets like very detailed. It's 90 hours on core knowledge areas, 60 are in, it should be, that's a mistake there too as well, I'm sorry, should be 60 hours in sexuality counseling. And for our program, we took the maximum that ASEC allows, which is 105 hours can be online. So we took that and we put it all online, and then it's attending for 2 3-day weekend intensives. Like we just had a weekend intensive last weekend. We had amazing speakers. We had Lucy Fielding, who wrote an award-winning book, Transsex. We had Dr. Mary Minton, who is a sex therapist up in Reno, Nevada. And we also had Ruby Johnson, who is, she's a Black social worker talking about BIPOC and consensual non-monogamy. It was a very interesting weekend. What else? The 100 hours of sexuality counseling. You have to take at least 12 months. You can't, ASEC doesn't want you to rush through this stuff. You do have to have a contract with an ASEC supervisor. It can be a counselor or a therapist who is a supervisor. And not everybody who is certified can supervise you. It has to be somebody who's ASEC certified supervisor. If you are a counselor, you can do your, sorry, I don't know why my mouse is very jumpy when I'm on PowerPoint. What was I saying? You can see a sex therapist for those hours or a counselor. The reason is that counseling is fairly new to ASEC, so we don't have as many counselors as supervisors, so you can work with a therapist.
And
Yes,
sometimes it's helpful to get a combination of all of it, where you may decide you don't have to have one counselor to do everything. Your one counselor or your one supervisor could be your main, and then you dive off into other areas of what your interest is. I had a couple as I went through certification. The other thing I want to note to my medical people is that you can kind of build out as well. Like you can pick and choose certain things. Some of you already may go to certain conferences like the ISHWISH conference and the AUAs and NPWH and these different conferences. And some of those hours may count toward your ASEC certification. I know I used some of mine with ISHWISH because it covered those hours because they get a lot of mental health people that go to those courses. So there are other ways to blend your hours if you want to just take a long period of time and dabble in a bunch of things.
right. And you can do it that way, but if you do it, the advantage
It's
of doing
harder.
it through,
It's harder.
it's harder. If you do, the advantage of doing it with the Bueller Institute is that you'll end up over time having less wear and tear
Yes.
on your pocketbook, and you end up, we give you a transcript at the end and a pre-filled ASEC application and try to make it easy for you.
Which
So-
is so nice because I'm not going to lie, the ASEC certification application is a little bit daunting.
It is. It is. An ASEC certification can be daunting, but we do our best to make that as streamlined as we possibly can for you.
Yeah, they're very good about it. And I will tell you, you do not have to, like ASEC is wonderful. And if you really want to pursue it, by all means, please do. But you do not have to be ASEC certified to counsel patients. And that's why ASHP was created.
Right. Yeah, it's completely up to you. You know what I think, to me, I was trying to explain to somebody what the kind of like what the mindset is. I think if you are going to really make the primary focus of your practice sexuality, then you may want to go full on for sex therapy or sexuality counseling or sex therapy certification. If you are, I saw somebody as an oncologist. So as an oncologist, using that as an example, if you are wanting to know how to counsel your patients, but you're not wanting to make your practice primarily about sexuality, then you may want to just stay with ASHP.
Yep.
Or you may want to do that first, and then at some point you go, you know what, I am so into this that I'm going to pursue the certification. So
Yep. I think especially for people who may be in an insurance model and you still want to wear your medical hat for a good portion and taking care of patients from a NPMD PT standpoint, then this is a really, really good place to start, and it may be enough.
right.
And then the other, and we talk about this in billing and coding. You may be an entrepreneur where you're like, you know what, I'm still going to do this, but I'm going to have a side business, and that's where I'll do my counseling. And that's where it may make sense to go down the full program. And we talk about that quite a lot and how to balance out what is the right move for you.
Right. Okay, so then just a little bit more. The supervision, I always suggest that you have try to get some group supervision, because it's nice to have other people to share cases with, hear what they do. It's a way of networking. It's also less expensive than doing individual supervision. SAR we always talked about, and so here's just a summary. Your degree, if you have a license to practice any type of psychotherapy. So I don't know if I have any like psychiatric nurses here, but someone like that would apply to be a sex therapist rather than a sexuality counselor, because you're really doing therapy. And then get 150 hours of education, attend the SAR, 100 hours of supervised counseling services, and 30 hours of supervision. So you can hear it is a lot. It's a lot. But sex therapy is it's a complicated, or sexuality counseling. It can be a very complicated area, especially since most of us don't get any training in graduate school. I know I got nothing. I got 6 hours. That's what was required for my license.